Hi everyone, this is Mr. Neil Wright here, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope. That initial view you saw was taken with our flagship iClearScope endoscope, and I've just reverted to the WAXscope for the purposes of the procedure. And I'm just using our 4.25mm speculum here just to straighten and dilate the ear canal. I've just reduced the exposure a bit because it was quite bright. This wax was quite reflective. And I've just adjusted the focus, and I'm just working at the base of the ear canal. I'm just trying to detach this wax. It was strongly adhered to the canal wall. We're just in the region of the ear called the isthmus, in between the first and second bend. And in a moment I'm going to annotate the first and second bend once I've removed this wax, so it gives you some perspective. And that's the narrowest part of the ear. So again, I've just adjusted the focus. I'm just lifting this up, and you may be able to see that thin film of dead skin that's enveloped this wax that's also adhered to the canal wall. And what the olive oil does, it helps to soften that skin, and it therefore allows me just to raise it up and away. And you can see I'm just going to wriggle this out of the ear canal, so it's quite a substantial piece of wax. So the WAXscope is due to be launched very soon, imminently. I'm going to be updating our mailing list next week, hopefully. Don't want to get carried away, but we're getting some our sample first draft speculi being delivered hopefully Thursday, and if all is well, we can get the ball rolling, so to speak. So I'm just mopping up some wax keratin just at the entrance here, well, just actually in that isthmus region, truth be told, between the first and second bend. Patient's got a nice healthy eardrum. It's got quite a bendy ear, so you can see, but going into the ear, and the eardrum's to the left, I'm just stretching and straightening the ear canal now so we can visualize the full part of the eardrum. Nice clear view. You can see the light reflex, you can see the blood vessels on the handle of malleus. So that's you can see the curvature of the ear canal, and I also annotated the first and second bend, so it gives you some perspective how bendy this patient's ear canal was. Same patient, this is their right ear. Again, I'm just dilating the ear canal. We have got 4 different speculi sizes. This is, for me, the medium size. This is what I feel comfortable using the most, a 4.25, but we've got 2 larger sizes, a 5mm and a 5.75, and also a smaller one, a 3.5. Immediately, I've just put some olive oil medical grade spray in there. I use the brand Clear, so I do work as a healthcare advisor to Clear and must declare any conflict of interest. If you do want to use this olive oil spray, we do sell it on our ClearWax website, www.clearwax.co.uk. And if you visit our public shop, you can purchase it. We only ship to the UK, mind you. And if you are a specialist wishing to buy in bulk, visit our website again, clearwax.co.uk, select sign in, register as a specialist, and you then get access to our trade shop and trade prices. So it is bulk orders, but of course you get trade price on that as well. So you can see I've just manipulated this large wax plug out. It's just got trapped near the entrance. So this is where the first bend is. It's hanging out the ear. So if you were stood beside the patient, you'd be able to see this coming out their ear. I was going to use a hook, but I just went back in with the suction probe because I felt I could just wriggle this out. So just getting a suction grip, and I'm just going to tease this out. So little wriggle motions. You can probably see the angle. I'm actually, the wax is coming out at an angle almost from left to right as opposed to from back to front, and that's the angle of the ear canal, so it gives you an idea of how bendy this patient's ear was. So I'm having to slide it out from probably 10 o'clock to 4 o'clock. That's the kind of trajectory. So if I was to put an arrow, probably southeast. It's almost there. And the patient had a big sigh of relief when I removed this. And you can see that skin, that glossy skin that's just enveloped the plug of wax. Just going to go back in, stretching and straightening the ear. Beautiful view of the patient's eardrum. Again, you can see the blood vessel supplying blood to the handle of malleus, the hammer bone. You can just see there how I change focus, so we can concentrate on this soft sticky wax just at the second bend of the ear canal. It's the cartilaginous portion, so we can put a bit of pressure. I'm not too concerned about this, as it's not occluding. mop up to the left as well. And we're going to stretch the ear open again, have another final look at the eardrum. And you're going to see a still image of the wax plugs that are removed. So the one to the bottom is from their left ear, there's the larger one out of the two. And from the top is from their right ear. Well, I hope you enjoyed that video, guys, and if you are interested in the WAXscope, please do email info@clearwax.co.uk and we shall add you to our mailing list. Thank you, bye.